Health and Human Services Secretary Robert F. Kennedy Jr., a longtime peddler of misinformation surrounding vaccine safety, has been moving to reshape U.S. vaccine policy, raising alarm within much of the medical community. According to new reports, the FDA's top vaccine official moved last month to limit the use of 2 COVID vaccines that had been approved, overruling recommendations by agency medical experts who plan to approve the shots for everyone 12 and older. It all comes after the new members of the CDC's Vaccine Advisory Committee, who were handpicked by Secretary Kennedy after he abruptly fired all 17 of its previous members, met for the first time last week. Among the agenda items was a presentation by a Kennedy ally on a debunked claim that a mercury-based preservative, which has been removed from nearly all U.S. vaccines, had links to autism. The committee also announced it would take a look at the childhood vaccine schedule and scrutinize vaccines that have been approved for decades. Well, joining me now is Dr. Paul Offit, director of the Vaccine Education Center at the Children's Hospital of Philadelphia and a former member of the CDC's Advisory Committee on Immunization Practices. Doctor, thank you so much for joining us here on Meet the Press Now. You've served on an advisory panel, so how unusual is it for a CDC or an FDA official to overrule the advice of the committee? And how concerned are you that medical professionals are getting left out of the policymaking process of all this?
Well, I think anti-vaccine activists have for decades been shouting from the sidelines. Now they're making policy. Robert F. Kennedy Jr. eliminated the 17 people on the ACIP Advisory Committee for Immunization Practices that had the kind of expertise and experience that we needed to get good decision-making. Now he's replaced them with people who are like him, science denialists and anti-vaccine activists, and to some extent conspiracy theorists. So now you're going to see an erosion of vaccine use in this country as he gets what he wants, RFK Jr., which is to make vaccines less available, less affordable, and more feared. It's a dangerous time.
And Doctor, I want to turn to the childhood vaccine schedule that we mentioned. What do parents need to know if the CDC decides to make changes?
Well, the good news is there are sort of these parallel advisory committees, like the American Academy of Pediatrics, National Foundation of Infectious Diseases, have now formed together and are working with insurance companies to make sure that if the current ACIP, which is really an anti-vaccine committee on immunization practices, makes bad recommendations, that at least you can turn to them and that insurance companies will cover vaccines that they recommend, even if the ACIP doesn't. So I think that's good. What worries me is that the CDC is also being eroded. And there are people who have quit the CDC because they feel that their data are being misrepresented or suppressed.
Where can parents go if they're looking for other resources about vaccine safety and what vaccines their children should be getting?
Well, I think still trust your doctor and healthcare professional. I think that they will be able to get the kind of information that they need to make good decisions, because for the most part right now, the medical and scientific community are ignoring the ACIP, as they should, because they have made a terrible decision last time on this influenza vaccine containing thimerosal. That was an anti-science decision. And the person who did the presentation was an anti-vaccine activist who gave that presentation without ever having her presentation reviewed by subject matter experts.
And are you surprised by how quickly, how sweeping these changes have been to U.S. vaccine policy, and what guardrails are in place to prevent the whole system from unraveling?
Yes, I think Robert F. Kennedy Jr. has gotten what he wanted. He's an anti-vaccine activist who's now taken over the system. And what worries me is what happened recently with the Global Alliance Vaccine Initiative. So this is a global alliance where the United States participates, and roughly 1 billion children have been vaccinated through this program, worldwide. It's probably saved 20 million lives. And he just withdrew from that program, which tells you he's perfectly willing to let children not be vaccinated in this world. And I think he's perfectly willing for children not to be vaccinated in this country.
How easily could a future HHS secretary or another administration reinstate some of the policies that Secretary Kennedy has rolled back?
I think that can happen. I do. I think that if things get bad enough and we do what we need to do, which is to ask Robert F. Kennedy Jr. to step down from this position, I do think we can put in place an advisory committee for immunization practices and reinstate a lot of what's been lost at the CDC to get this back again. I do.
And Doctor, there are still vacancies at the CDC's Vaccine Advisory Panel. What will you be watching for as those positions get filled?
Well, you'd like to think that they would bring on people who actually go with the good science instead of this sort of anti-vaccine activism that's going on. I'd like to think that's true. But, you know, what really has to happen is there are 6 members of that committee who would never pass a confirmation hearing. They shouldn't be there.
And Doctor, just big picture for us, how concerned are you that future vaccine advisory committees will lose credibility?
Well, it's sad that it's become partisan to the extent that it has. I mean, public policy is always, to some extent, political because it depends on resources, but it doesn't have to be partisan. I think that we will regain our senses and put things back in place fairly quickly. I do believe that, but for right now, it's going to be a rough time.
Dr. Offit, we thank you so much for your time, sir.
We thank you for watching, and remember, stay updated on breaking news and top stories on the NBC News app or watch live on our YouTube channel.